So are you tired of your back or neck always hurting? And is your posture to blame for your pain? And could clinical Pilates be the fix you've been looking for? I am Bruno de Jongh, senior physiotherapist with over 20 years experience. I'm the CEO and clinical lead at CBR Clinics, and we've been helping people for over 10 years to overcome physical and mental health issues that are hindering them from living their level 10 lives. We have clinics in Waterloo, Elephant and Castle, and Canary Wharf. And today we're going to be discussing why so many people have back, neck pain, postural pain. And I'm going to give you some data. We're going to talk about what actually works, and we'll talk about different types of treatments. And I've got some studies and research to give you to back that out with. We'll talk about what is clinical Pilates, how does it compare to regular Pilates, how does it look like, what equipment do we normally use. I'll show you some pictures of common postural patterns that we see. So what are the great candidates for clinical Pilates? I'll share with you a success story as well that we've had in clinic. And at the end of this session, I will give you an offer, which is limited until the end of July, and you can use it in August. We're also going to have a Q&A at the end. Okay, so why people have back, neck, or postural pain? So what the data shows us is that 80% of people will experience back pain at some point in their lives. And neck pain itself has risen up from 14% to 28% since COVID. And I actually talked about this in my previous webinar with students. It has gone up to 63% or something crazy like that, because it's all become online, and we've become more online. We work from home. So the environment has changed since COVID. The work environment, people working from home more, they have less breaks, they sit more, they don't walk. Sometimes people would mute and they maybe walk to work, or they will cycle to work. People are not doing that as much. That leads to sitting posture issues. At home, they might not have the right setup with computers and desks and all that. That can create muscle imbalances, and maybe other things will be creating muscle imbalances anyway. We know that people who have glutes, so people who sit for long periods of time, they might experience something called glute amnesia, which is when the glute muscles, the bum muscle, stops working. And then people come into clinic with back pain or whatever, and you test it, and there's just nothing going on there. And we know that some of that comes from sitting a lot. And that can also, all this can also lead weakness in the core. And I mentioned, I'm getting ahead of myself. So weakness in the core as well. So which one are the core muscles? People think core muscles is just abdominals, just in the front. But actually, core muscles are the abdominals, your obliques, which is on the side, lower back, glutes, and inner thigh muscles. So there's a lot of muscles going on there. Then that can also, so with COVID and working from home and more social distancing, I guess, because people don't go to work, they are more distant, or some people really need to go into work because they need the social aspect of it. And people who don't go to work sometimes, or people who are not required to go to work anymore, maybe they want to go but don't go. Regardless of that, these days we have a lot more anxiety. And this can be a bit of chicken or egg question. Are we having more poor breathing mechanics because of anxiety? Or is because our work environment has changed that is creating poor breathing mechanics, and that's then leading to, so we don't know which one is which. It could be a combination. It could be that for some people is one, for some people is another, is the other. But regardless, that's something that we are dealing with, more anxiety and just poor breathing mechanics. So what actually works when it comes to rehab, or when it comes to trying to get out of pain, or treatments and all that? So chiropractors, and I no disrespect to any of what we're going to talk, masseurs. I mean, I worked with chiropractors, I worked with masseurs, with PTs, all of those. But they all come with the caveats, and it also depends what the therapist you're seeing specializes in. For instance, I'm a physio, so it will be by trade. I should be treating people mostly with exercise prescription, but I do a lot of hands-on because I like it, and I do all the manipulation, or almost all the manipulation that the chiropractors do, that the osteopaths do, because I just like doing that kind of work. And I used to have an osteopath who used to work with me. So he was all osteopaths by trade, the manual therapists. They like to click people, do all that stuff, or at least they train on that. But I used to have an osteopath who only wanted to do one-to-one Pilates with people. because that's what she wanted to do. That's what she was comfortable doing. And she got the same results. It was just a different pathway. So it depends what they specialize in. But if we're talking the baseline or by trade, that's what they do. Chiropractors, what happens is they do a lot of the adjustments. A lot of chiropractors, they do 10 minutes appointments. You come in, they lay down, crack, 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 done. So they do those adjustments. There's some research on that, but the research also says that there is some short-term relief for mobility. You can't really improve massively your mobility just with this. You gotta have something else on top. However, it can help reduce nerve irritation and joint stiffness. It is a passive treatment, so it doesn't address movement dysfunction. It can address muscle amnesia. And I see this in clinic, and I do this myself. So clients come in, the shoulder's weak, and the problem is on the neck. You click the neck, shoulder strength comes back. It will do that. But the movement itself, or the biomechanic of it, it doesn't address that. So the adjustments of the chiropractors, they are passive treatments. And people will pay to go to the chiropractor once a week or once a month, forever, to just so they don't have to do the work, which is the exercise and all that. So all these leads to improvements, temporary improvements, if there's no exercise rehab attached to it. So a lot of chiropractors, they do the exercise rehab because they understand how important it is to retrain the brain and the muscle memory and fix the biomechanics. They do that. Just the adjustments on their own, they don't. And a study from 2011 suggests that manipulations, the adjustments, are no better than exercise rehab. So like I said, it is a passive treatment. So you can go and just have that forever. It will cost you time and money. And if you don't like exercising, maybe that's the right choice for you, and that's fine. But we really believe in empowering people into just owning their issues and fixing themselves. So a dependence relationship. So people who are on a membership with us, they do come once a month, sometimes once every 2 months. And the sessions that we do for those are very empowering. So we tend to give people a lot of information. This is the new exercise program. Let's do the manual therapy. Let's do some manipulation, acupuncture, whatever it is. But here's your new exercise rehab prescription, because this is how you're presenting today. So they go home with lots of homework to do. Massage. So we do lots of massage in clinic, right? They're great for short-term pain relief and reducing tension. It helps with stress, general well-being. So who doesn't feel great after a massage? It doesn't address, like the adjustments, it doesn't address postural control. It doesn't address weakness. It doesn't address movement dysfunction. So if a shoulder is clunky, they've got a wrong pattern there, you can have a massage to relieve the symptoms, the pain, but the dysfunction is not going to fix the dysfunction. And another study from 2015, massage is not preventative. It can help with symptoms, but it's not going to prevent the issue from coming back or from even manifesting itself. Personal training or strength coaching, so strength and conditioning. And this is perhaps people who are not healthcare providers, not sports therapists, who are not physios or anything under that umbrella. This is more just personal trainers, some strength coaches, whatever degree they have. They don't usually, some have a degree, a lot of them don't. So it's good for building strength and fitness, can help with motivation, movement, confidence. And I'll tell you what, I've worked with a lot of personal trainers who actually, they have gone out and done a lot of studying and they understand a lot. And they do a lot of rehab work. So if you're picking a personal trainer who does a lot of rehab work, great. They probably know the stuff. And I personally have met and have worked with several personal trainers who knew their stuff, but generally they know a lot less than the physios, especially when it comes to biomechanics. So they're not trained to assess or correct postural movement dysfunction unless they go out and train separately. And there is a risk of aggravating pain without clinical insight. So, and I have seen this, people come into clinic because they got injured, because the personal trainer just didn't know. Not from their fault, just didn't know. And people got injured. Nobody knew. It was the first time. It happens. So they may overlook the deep stabilizers for breathing mechanics, the spinal stabilizers as well. The deep core muscles where we address with Pilates. Yoga. So I'm a big yoga fan. I do yoga every day. Maybe not every day, but 5 days a week, and it will be from 10 minutes to 30 minutes, anything like that. It really helps me to keep my pains at bay and all that. So I love yoga. It helps to improve flexibility, awareness, calmness. So it helps with mental health. It can support mild postural improvements. It is not individualized. So if you go into a yoga class, it's not individualized. And you might get some adaptations if you have some pain and you tell the teacher, look, I don't feel great about this. Can you give me an option? They will give you an option, but it's nothing to correct. It's just to prevent things getting worse. So we're just being careful when that happens. It may exacerbate issues if underlying dysfunction isn't addressed. So if someone has a weak glute and they don't address it, and they go into a yoga class, they're going to do a yoga class with a weak glute. So they will have to overload something else when it comes to demanding their glutes to work, because it's not going to work. So some other muscles are going to have to kick in to do the work that the glute's not doing, and that's going to create the dysfunction. And then there's a study that says yoga helps with symptoms, but less effective than target rehab exercises. Right, physiotherapy, or broad clinical knowledge, good for injury diagnosis, can provide helpful exercises and manual therapy. First step of physio is managing the pain. It can focus on isolated body parts, and this might come with experience a little bit. So I have people coming to me after seeing 4 or 5 physios, and suddenly we got some answers there because I'm looking at the whole picture. And when you get people who are less experienced, they might not have the capacity to do that yet. So there is that risk. And without integrated movement retraining, movement habits may not improve. In CBR clinics, we have a really good process, a follow-up process from the physio. People go from the physio into strength and conditioning or clinical Pilates, because we know that's going to keep problems away. It's going to keep the problem from coming back, and it's going to help prevent a whole other array of things, and it's going to improve people's fitness, mobility. It's just going to add years to their lives. And a study in 2016 says it's effective, but better outcomes observed when tailored and combined with behavior change strategies, which is what I'm talking about. We gotta change the behavior. After the physio, people have to change a little bit. They can't go back to what they were doing, how they were doing, because that's how they got injured. So you gotta change a little bit, because if you don't change, nothing's gonna change, right? Okay, Clinical Pilates. It combines clinical assessment with targeted movement retraining. It improves core control, posture, breathing, balance, and strength. So it ticks all those boxes. Movements are specific to each person's pain, posture, and limitations. And we're talking here about 1-to-1 Pilates, maybe 2-to-1. So 2 people and 1 instructor. A lot easier to stay on top of people who maybe don't have good coordination or don't quite understand where they should be feeling it. And sometimes you do some corrections by touching people, say you need to pull your shoulders down, and people suddenly go, okay. So by doing that, by touching, it helps to activate the muscles more, or even bring awareness to that area, and then suddenly people can engage the muscles better. It is an ongoing progress. It is ongoing progress, and results are always monitored by the clinician. So it's not 1, 2, 3 months and then it's finished. You just keep going and you keep progressing, and we know that, like I said before, it keeps people healthy. It keeps people injury free. Injuries might happen still, but it minimizes a lot. So a study from 2014 study found that Clinical Pilates significantly reduced pain and improved function in supervised 1-to-1 settings. So that's really important. You go to all those classes, they're great. It's going to be like the yoga we talked, not personalized. It's like one size fits all. It's going to be a little bit like that. You might try to flag things to the teacher. They might do their best to correct it. Most classes in the gym, Pilates, they're the instructors. And I know because I'm still a fitness instructor, and to become a fitness instructor, you need to do 2 weeks of training, and you have to do another home study for the body works, how do you call that? Okay. And you do some exams, paper online these days probably. It's really not rocket science. the way they do it. So it's a lot of it comes with experience, and I have been to fantastic yoga classes, to fantastic Pilates classes, because people have the experience. With experience is everything, right? But the disadvantage, if they're not clinically trained, is that they will need that experience. Whilst if you're clinically trained, you've already got your physio under your belt, and then you've already got some years of physio, and then you jump into the Pilates. So by the time people jump into Pilates, a lot of the time they've had 5 years of physio training, plus another 2 to 3 years of physio experience. So they've got about 8 years of learning all this stuff. It's a different ball game. So what is Clinical Pilates? So it's a type of exercise program, I'm just going to read it, based on principles of Pilates that is specifically tailored to individual needs after using rehabilitation settings. It is led by physiotherapists or other health professionals who assess a person's movement, strength, and flexibility to create a personalized exercise plan. So unlike general Pilates classes, Clinical Pilates addresses specific injuries, conditions, or movement limitations, making it suitable for individuals recovering from injury or managing chronic pain. So people come in to clinic, they have an initial consultation for Clinical Pilates normally, and this is probably across most clinics in England that I know. I'm part of a huge coaching group. There's about 60 clinic owners in there, and half of them run Pilates classes. So you have an initial consultation. It could be an hour. So there's an assessment that happens. So there's most of the time, people go from the physio to the Pilates. There's a lot of information coming from the physio, which is in the same premises to the Pilates physio. But the Pilates physio is going to do their own assessments so they can understand where the limitations are, the notes match with the physio, and then create a plan from that. So it's very bespoke, it's very individualized. And what does it look like if you've never seen or you're not quite sure? You need a yoga mat, one-to-one in a studio, or in a room, depending the setting or the clinic you go to. We have different settings. One of our clinics is at a gym, the other one's is at a diagnostic center, the other one's in a business center. So they all look a little bit different, but a big enough room to do exercise. You have a yoga mat, you have a Pilates ball, which is a medium-sized, inflated. People usually look at it. You need to inflate that. No, it's supposed to be like that. You got Pilates ring. You can do stuff with your legs, you can push with your hands, you can pull, all to help activate core muscles, shoulder girdle, and all that. Again, the Pilates ball, the same one from before, you might be using on your feet or doing different exercises, core work. All this here is heavy on abdominals, inner thigh strength. Here, some Pilates weighted balls, usually 1 kilo, 2 kilos, just to add some variation to it. But that's usually what it's like. It's lots of work, lying down on the mat, sitting exercises, half sitting, on your front, on your back, on your sides, all sort of positions. And like I said, the initial usually an hour, you do the assessment, and the follow-ups usually 45 minutes. That's plenty of time to get people worked out. How long do you need to work just your core muscles, right? Even though there's a group of them, you can hit them hard in 45 minutes. Here is just my video is just on top of this. So Pilates versus regular Pilates. I'm not going to read everything. Following on the left, you've got the Clinical Pilates. On the right, you've got the regular Pilates. So on the left, led by physios or rehab professionals, regular Pilates fitness instructors or Pilates teachers. The goal of Clinical Pilates is rehabilitate injury, improve biomechanics, restore function. Regular Pilates is more general fitness, flexibility, tone and strength, which is great. Clinical Pilates starts with an individual clinical assessment, and in a class, you get in, find your space, crack on with that. There's a lot of personalization on Clinical Pilates, which is based on specific conditions. For regular Pilates, one-size-fits-all approach, even in beginner or advanced classes. Clinical Pilates safety is suitable for people with injuries, post-surgery, chronic pain. Regular Pilates, people with injuries, post-surgery, come back when you are 3 months out of surgery. Then you can join in. Clinical Pilates supervision, more hands-on. There's hands-on corrections if needed. In group settings, it just doesn't happen. And so it goes. So quite a few distinct differences in there. So common postural patterns, typical. Head forwards, and you would normally see this. Well, you see, I'll tell you, you'll see this on men who are guitar players. They have this head forward, hips forward, because they have the guitar sitting on their laps while they're playing. a lot of young people these days, because of phones, they're just always looking down on the phones. People who are working on laptops, which are terrible. If you're going to work 1 or 2 hours on laptops, fine. If you're going to be working days and days and days on a laptop, you're going to end up like that. Before you would see this, perhaps more in the aging populations, around 50, you start seeing some changes like this. 60, 70, you start seeing this. These days, not so much. And here's a little bit of a sway forward posture, perhaps like pelvic tilts for the belly arriving first, which is not dissimilar from the first picture. But the first picture, there's a lot more of a hunch, a bigger kyphosis, whilst on the second picture, there's more of maybe a lordosis, where the lumbar spine arches more and the belly protrudes more. So those are why those two are great candidates for clinical Pilates. Success story. So I've done a podcast with Nigel probably 2 months ago now, and Nigel's over 70, had a knee surgery to realign the joint because of severe arthritis on the. Because of that surgery and the realignment, knee was in extreme pain. He created all this compensation, which then led to a lot of back pain because of that. And he could not shift that back pain. He's done injections, sure, he's done a lot. This is a very active 70-year-old, actually an example to be followed, because this fella exercises 5 to 7 times a week. He would do HIIT training, running, weights, yoga. He'll do everything and anything to stay fit, stay ahead of his game, and to make sure he's just moving, just trying to stay healthy and pain-free. But we did see Nigel for quite a while with physio, and like I say, he had injections, he had acupuncture, and nothing was shifting this back pain. And then I said to him, just go and do some Pilates. Just give it a go. He was very skeptical about it. And in about 4 months, we podcast, so live podcast was end of May perhaps, or May, and he started with the Pilates, was it January or February? So it was 4 months. Different. He's different. If you watch this podcast, he's different. He still has pain, but because it was quite a severe back pain he had, that nothing was touching. What we've achieved with him is actually huge, because it's all down to his persistence, to being consistent and just turning up for himself. And he was doing, I think, only once a week. Yeah, it was once a week Pilates. And then the other days he would do a little bit on the side, on top of all the other stuff, all the weights. And he wasn't doing any running, but he was still trying to do some HIIT training with low or no impact. So he was being very diligent outside clinic, but he was committed just once a week, and we had a huge reduction in his pain. So the special offer is, so it's a free Pilates-based session. So it's what we're talking about, the clinical Pilates-based session, 1 hour assessment, entirely free. Come in, try, see if you like it. It will be an hour. It will include the assessment plus the bespoke workout. You could be done at any of our locations, Canary Wharf, Waterloo, Elephant and Castle. They're limited spaces because we provided people with that last month. And I think we've got, I'm going to say 8 slots, 7. And once they're gone, they're gone. And you have to book in by the end of July, but you can use it in August. So say you have until the 1st of July to book a session till the end of August, because I know people are going away now and all that. And then as a follow-up from that, if you are interested and you want to try a little bit more before committing, we are offering a heavily discounted program of 3 sessions. So you'll be paying a fraction of the price. And that's pretty much it in a nutshell. How did I do? I did about 30 minutes. Okay, that's good. I'm happy with that. So Q&A, guys. So before you start, just to let you know that this will go, I will publish this on our socials. If you want to ask any question now, if you don't want to show your face, you don't want to be recognized, you can just type a question on the chat. And if you don't have any questions, that's fine. I've got quite a few questions here, but I'll probably restrict myself to 2 that people have filled out on the forum, just because people are going to watch this after. You're going to get a recording afterwards. If you have any questions now, feel free to turn your mic on or just type in on the chat. Otherwise, I will on the questions I've got here. Yeah. Probably not, to be honest, because the private medical insurance, they normally cover an issue that you're trying to resolve rather than ongoing care, which is what this would fall under. Yes, if it was a physio session, then yes, it wouldn't be that. So they probably you could ask them if they have some sort of cover. I don't think so. Yeah. But if you if you wanted to try, I will. So there is an email going out tomorrow with instructions on if you want to give it a go. Come in, do the one session, see if you like it. There will be instructions on how to do that. The email is going out tomorrow. Yeah, great. Thank you for the question. How to stay motivated? It's a tricky one, For me, I think I certainly feel or have felt demotivated in the past, and I think these days one of the biggest problems that we have these days, I'm going to go too deep here, but one of the biggest problems we have here is that too much noise out there. There's a lot of distractions, a lot of TV, a lot of phones. It's quite easy when we are overwhelmed, when we're stressed, just go on your phone, just watch another episode of Netflix. So I think what made the difference for me, because I went through a rough patch a year or two ago with all this being motivated with different areas of my life. For me, it was reconnecting with my values and scrutinizing everything. So it was about reconnecting with my values and scrutinizing everything I did and asking myself, why am I doing this right now? I'm grabbing my phone. It's like, why am I grabbing my phone right now? Do I need to see my phone right now? And I'm just doing this out of habit. And then I'm scrolling on Instagram for 5-10 minutes. And then asking myself, why am I scrolling on my Instagram? Could I be doing something better with my time? I'm binging on TV. I used to play a lot of video game. It wasn't proper addiction, but it was borderline. It was problematic enough. And I sold everything. I sold my PlayStation, got rid of all the gaming because it just conflicted with my values. My values were about family, were about being there for my kids and spending time with them and being healthy. How playing video games supports that value. So stay motivated is a difficult one. And if you really want to get to the root of it, ask yourself, what are your values and are you living by them? Because if you're not, what are you living by? Anne, hello. I can hear you. How are you? Okay. Can I ask some questions? So how old are you? 83. And do you do any physical activity? Oh, so this was recent, this. Oh, wonderful. Yeah. All right. I see. So the cycling is not a constant. So is it that, and I'll be completely honest, I'm not super familiar with the symptoms of Lyme disease. I'm going by what you're telling me, and I assume that people will experience, like most things, people will experience different levels of symptoms. Some people will have extremes, some people will have a little bit, some will be maybe in the middle, right? Yeah. Okay. And then do you feel that exercising or doing your gardening aggravates your symptoms? How long? An hour. Okay. Okay. And then you say you do swimming and dancing. Are these constant? Right. So how long are you sleeping for? Daily. And when did you contract that? 3 weeks ago. Very recent. Wait it out. But the prognosis is that it just sort of gets better or okay. So I think it's probably early for you to do anything like this, but what I would like to do is actually look into this and come back to you privately on an email. I'll just send you an email with what I found and what my advice would be, because I just don't have enough information on this to be able to tell you right now. But I'm quite interested on finding out more about it and then coming back to you. Yeah, my pleasure. My pleasure. Guys, I'm probably going to wrap it up because we're up for 45 minutes now. Thank you so much for participating. It was a pleasure. You're going to receive an email tomorrow with a follow-up on how to book in for a free session if you want. There will be a live recording going out. I'm just not sure if I'll be able to put that out tomorrow, but you will go out soon at some point. Okay? Thank you all. Have a great evening. I'll see you soon. Bye. Thank you.